So we're going to start with the first one, which is the COCs. It's called combined hormonal oral contraceptives. The combined oral, they're oral tablets that you take. And how do they work? They contain two hormones, estrogen and progesterone. They contain both estrogen and progesterone. So we have to now understand, how does it work? Let's remember, how does estrogen and progesterone work in contraception? First, we have the hypothalamus. The hypothalamus releases a hormone called the GnRH. What happens is, GnRH goes to the anterior pituitary, where it releases two hormones known as FSH and LH. FSH and LH goes to the ovary, where in the ovary they releases two hormones known as the estrogen and progesterone. So in the normal physiology, when there's too much estrogen, a high amount of estrogen, it goes to the anterior pituitary and tells the anterior pituitary, we are too much. Stop. So that means it inhibits, it decreases, it causes something we call a negative feedback to the anterior pituitary. What does the anterior pituitary do? It's like, okay, since you guys are too much, let's decrease FSH. Let's tell FSH to stop the production of estrogen. The same thing goes for the progesterone. Progesterone goes to the anterior pituitary and tells the anterior pituitary, we are too much. Stop. That means it's given negative feedback. And what does the anterior pituitary do? It says, okay, let's decrease the LH production. Decrease in FSH and LH production leads to decrease in progesterone and estrogen. So that means you won't be, as we remember, estrogen is responsible for follicle development, and progesterone is responsible for the endometrial development. So there won't be any of these two. So the baby won't be formed, and then there will be mucus, cervical mucus thickening. The sperm won't be able to penetrate into the ovaries, and a lot of issues that we'll discuss. So in the COCs, we have two hormones, which we obviously know. The estrogen contains the ethynyl estrogen, estradiol, and the mestranol, while the progesterone component contains progestin. Okay. We're going to start with the estrogen component. First, we want to understand, remember how they work. Estrogen works by inhibiting, giving a negative feedback to who? To the anterior pituitary. We're going to write the anterior pituitary in pink to remember. Then what does anterior pituitary do? He says, okay, stop FSH. FSH, reduce. So it decreases FSH. And if we have decrease in FSH, that means we're going to have a decrease in estrogen. If we have a decrease in estrogen, what do you think will happen? Decrease in estrogen leads to decrease follicle development. What is follicle development? This is when the follicle moves from this to this and to the last stage where it grows so big and the cells are all around the follicle ready to release the egg. So it stops this cycle of follicle development. And what do we think it also does? So we notice that apart from inhibiting FSH and inhibiting ovulation, this is ovulation, when we have the egg being released from the follicle. Apart from this release and development, it does two extra things. The first one is it increases the aldosterone level. And it increases the sex hormone binding globulin. This has both advantage and disadvantage. Increase in aldosterone level, as you remember, increases sodium water retention. Hence, our patient will have edema and water all over her body, having a false weight gain. Because if she goes to check her weight, she's going to see that she has gained weight. But this is because of the increased sodium and water retention in the body. The increased sex binding hormone globulin, we have to see the physiology is that this is the hormone. This hormone binds to androgens in the body and reduces the androgen to the body. So if it increases this hormone, we're going to have a lot of androgens, sex hormones being produced, binding to all the free testosterone in the body. And remember, testosterone is responsible for producing acne in our patient and hirsutism. So if you have decreased testosterone, you're subsequently decreasing hirsutism and acne, which is really good. Like, the patient will be so excited to know that her acne and hirsutism is being released. So let's get the relationship. Increased testosterone, but that's the free testosterone, results in increase in acne and increased hirsutism. Hair on the face and chest area, that's hirsutism. You'll hear a patient, a female patient, saying she has hair all over her neck, she has a mustache which she doesn't like. So if you have a hormone that binds to this free testosterone and says stop testosterone, what you're going to have a decrease in acne and decrease in hirsutism, which is really good for the patient. Like, they get really excited about this help. But then we also have the adverse drug reactions. What are the adverse effects of this? So basic adverse effects like nausea, vomiting, and then we have bloating and edema. Why do we have bloating and edema? Because we have water retention. So that means your patient will gain more water. She will have more water on her legs, her stomach area. Then we have irritability, and we have hypertension. This is like really serious. Why? Because we have increased sodium and water retention. So that means we have increased blood volume. And remember, if you have increased blood volume, you have blood rushing to your heart, which means you have hypertension. So that's why we avoid, like, this is big, avoid giving COCs to hypertensive patients. Ask your patient, are you hypertensive? And she says, no, I am not, you can give her. But if she says, yes, I'm hypertensive, avoid giving them COCs. And you have to remember, COCs causes, it stops pregnancy. So ask your patient, do you want to get pregnant? And if she says no, you can give her COC. But if she said, yes, I want to get pregnant, you can't give her COC, because that's the main reason you're giving her COC, to avoid the pregnancy. It's also used for hirsutism, as you remember, acne. It could be used for cycle control and many more. That's why you have to ask this question. What's your aim for taking COC? So it also causes false weight gain, remember, from water retention. And it could cause cyclic headache as well. The next one is estrogen helps in the breast development. So it causes breast fullness as a side effect and tenderness. So I think that should be all for the estrogen component. We're going to move to the next one, which is the progestin component. So the progesterone or progestin component has two just like the estrogen, which has ethyl estradiol, the progestin has two components. We have the norethindrone and the levonorgestrel. So let's remember how it works. Hypothalamus release gonadotropin releasing hormone, goes to the anterior pituitary. Anterior pituitary releases FSH and LH, which goes to the ovaries and release estrogen and progesterone. This goes to the anterior pituitary and say, we are too much. That means gives negative feedback. Anterior pituitary then takes action by decreasing LH. Decrease in LH decreases progesterone, and we have low progesterone. So what happens when we have low progesterone? This is like really important because a lot of things goes on, like when we have decreased estrogen, we have like increased sodium water retention, we have increased sex hormone binding globulin. For the progesterone, we have decreased LH, like we know, and if we have decreased LH, we have decreased ovulation. That means the egg won't be released from the ovary. We also have increased cervical mucus. So this is really important. So we're going to do this sample. So we're going to use this picture as a sample. So this is the cervix, and there's usually mucus around this area. So when we have too much mucus around this area, that means the sperm won't be able to cross and go into the ovaries. So it increases cervical mucus, which decreases sperm penetration. And it also makes the endometrium very, very uncomfortable for zygote formation. Look at this. We all remember that the endometrium used to form really well for the zygote, for the baby. But then because we have decreased progestin, we're going to have like a very, very different situation in this area. So what else do we want to know from this is that it causes thinning of the endometrium, like very thin. Remember, usually we have this very thick place for the baby, but in case of this, we are going to get a very thin layer, very thin, which the baby can't even stay in that area. And then we have side effects that we would experience. It also causes weight gain, but this is the real weight gain. And then it causes headache, it causes increased appetite to eat, it causes depression, fatigue, and change in libido. So I hope you understand this, because this is really important to understand how these drugs work, and I'm going to ask few questions about this. What are the two ways estrogen work in COC apart from inhibiting FSH? The second question is, what are the two ways progesterone work in COC apart from inhibiting LH? The answer is simple. For estrogen, it causes cervical mucus, it increases the cervical mucus, which stops the sperm product penetration, while in estrogen, it causes an increase in aldosterone and increase in sex hormone binding globulin. So this is basically it for the contraceptives for the COCs. That's a combined tablet. Thank you.